Hello, I'm Quentin Fisher, founder of Aidan Health, and we're here to give you an overview of our solution set. The current state of healthcare really has limited operational controls with the current electronic health records that are in place, and we have a ton of employee burnout with the pandemic, and patients are demanding to be treated like customers. So we're seeing a lot of consumerism that is driving the industry as well. With it, Aiden, we're really working to help healthcare organizations become anticipatory enterprises and use prediction to really understand what's coming so that they can react ahead of time, um, and instead of waiting for problems to arise or getting bigger. We're going to use that to really improve the experience and quality for the providers as well as the patients. So let's get into our solution set. Within Aiden, we really have a broad solution set, but it's really anchored with the predict product. We then take these predictions, these insights, and then we help develop solutions around planning in the 2 to 12 month horizon so that organizations can optimize and orchestrate their health system and their health facilities. We help organizations schedule better, optimize their schedule by building a probabilistic schedule. And we also help organizations engage better with their patients and have more intelligent reminders. But it really comes down to the prediction. So I'm going to talk a bit about prediction, and these first two modules, predicting, and then talking about planning and scheduling. So the first prediction that we're going to do is predicting patient visit volume. Outside of healthcare, this is referred to as forecasts. So this is an example of us predicting USA level visit volumes as well as state level visit volumes. And in this telehealth example and customer, there's over 60 states and territories that we had to plan and forecast. It's very important because there's different credentials and licenses required for every state. So having the right team on place to deliver the demand is very important, but you first need to understand the demand. And what we found was that the pandemic really kind of destroyed the ability for this organization to have reliable predictions on what the demand pattern for the visit volume is going to be. So we used some very sophisticated machine learning to develop some really robust forecasts and predictions on visit volume and improve their forecast accuracy 50%. We did this both looking at a kind of a shorter term horizon, 6 week, as well as a longer term horizon, 12-month, and once again at an aggregate national level and then also at a state. This can be done as well at the by hospital, by department. It doesn't need to be national and state. Any kind of segregation. So I'm going to talk a bit about this. So what we did here was with the planning, the prediction. So what do we end up doing with that forecast? Well, then we ended up handing that off into this kind of planning app. And that forecast was then driven down into really understanding the requirements for the providers at a daily level. In this case, it's a 6 or 4 week horizon that we were looking at, and really understanding the requirements for the staff, right, based on the patient visit volumes. We could then bounce that off of the actual coverage and understand where where they were hot and or understaffed, and when where they were overstaffed, and that was very important in helping them effectively cut their wait times in half, right, and save millions of dollars a year because they're able to plan ahead and make the appropriate adjustments and treat the patients that needed the care, right? So that's one example of how we use forecasting in a prediction and then develop a plan. We then have another solution where we actually predict the no-shows and the schedule load. So we can actually then determine as well what's the probability of some of these patients and these appointments actually showing up. This is very relevant for the ambulatory side of healthcare, where we do a very good job at predicting. This example shows where we're predicting over 5,400 schedule hours. We predicted about 3,752 and actually came in 3,758. So kind of very accurate at the aggregate, but it's not just about that. So we're pretty accurate on what's going to happen, but it's about understanding the probabilities of each of these appointments showing up. And what we found interesting when we did this is about 20% of this in this specific model for this specific visit type. We found that 20% of the appointments only showed up half the time. So this then drove us to drive different schedule strategies for these red appointments, for the yellow appointments, and for the green appointments. As an example, this is for the red appointments, we really wanted to manage our schedule risk. For the yellow appointments, we really wanted to schedule strategies to encourage nudging activities. And then for the green appointments in this case, we came up with different approaches around they could schedule out further, and you could really kind of get that good booked backlog in your schedule. So we have different models depending on the specialty, the visit types. We have a number of different factors that we use to kind of have these kind of very accurate predictions on, once again, the no-show rates and also the schedule load. But once again, that's the prediction part. What do you do about it? This is where the schedule comes in, where we're able to take that and actually improve the capacity of these facilities by 20%. Well, how do we do that? Well, we first have this scheduling app that has provider-specific rules. So we're able to have very granular rules in how to schedule, when to schedule, a lot greater granularity and controls than what's in the current EHRs. This is very important for driving provider retention and control, right? And then we take a lot of those red, yellow, green components and we build a probabilistic schedule, and we only return the schedules that are appropriate. So in this case, we're returning these specific slots back, but we have rules behind the engine that basically say if it's a red appointment, you may only want to double book it with another appointment. If it's a green appointment, you may allow certain other time slots, and just different schedule strategies once again for that, so that you can improve the access and once again drive that 20% increase in capacity by being intelligent about how you're scheduling. So with that, we can see significant savings. So we also have some engage modules and some remind models that reach out and pull patients in and just interact more intelligently with the patient on the reminding side. But in summary, right, we have these whole kind of solution kind of components. These add a ton of value for our customers, and this is there's just a lot of opportunity to use math and prediction once again to really drive operational performance. Thank you for your time.